As more baby boomers approach retirement age, they're faced with new financial challenges. These can range from living on a fixed income to a sharp increase in the cost of medical treatment or even long-term care. To help with planning for what's ahead, there will be a free financial services workshop on November 2nd, put together by the state chapter of AARP in partnership with Mass General Hospital and the Elder Healthcare Disparities Coalition. To tell us about the event and some of the topics is our guest from AARP, the Outreach Coordinator, Jacquie Bishop. Thank you very much for being with us, Jacquie.
Thank you for having us. We greatly appreciate it.
Jacquie, whenever I hear the term financial planning, I think of people who have lots of money and lots of very knowledgeable advisors, but I guess this is not just for people with money.
This is actually not really for people with money. We're really trying to do this on a community-based level. Whether you're on a fixed income already for whatever reasons, or you're still working, we really want people to think about, what am I going to do when I stop working? How am I going to retire? How will I be able to take care of myself? And that's really what this workshop is about, or this mini-day conference is about.
And I think you want people to start thinking about these things not the week before they retire.
Right. No, absolutely. Whether you're 20 years old or you're 55 years old, we all need to be thinking about the day I stop working, for whatever reasons, how am I going to take care of myself for the rest of my life? How will I be able to take care of my housing, my food, my health care? And this conference will talk about how do you build a timeline for yourself based on your age, based on your career choices, based on working or not working. How do I protect myself into my future? And this is a great opportunity for anyone, regardless of the amount of money they do or don't have, to come and learn a little something.
I imagine the most common problem, at least serious problem, is that people might have a spike in expenses, some sort of a medical challenge. So what do they do about it? And when do they start doing it?
What we tell people is to try to have 6 months of money in the bank for a catastrophe, whether it's your roof falling in or an unplanned healthcare issue that's not totally covered by whatever health insurance you may have. Unfortunately, in Massachusetts, 98% of the populace is covered, have healthcare, but still. So how many people have 6 months of money in the bank? Very few. It's cash. Folks need cash. Things come up all the time. But in planning for it and allowing yourself to think, let me put $20 away, let me put $50 away, let me put $100 away that I do not touch. Let that build over time. Let that gain a little bit of interest. Put it someplace where you can't get to it until you absolutely need it as opposed to want it. That's what people will learn about in this conference. And I think that healthcare in particular is one of the most obvious things that we can't plan for when our bodies might give out on us for whatever reasons. So it's something that we do need to plan for, not knowing when and if it will happen.
There's another serious topic, and it doesn't really involve money in a direct way, and that's about healthcare proxies. Why are they so important? Oh
my gosh. So if you are ever in a position where you are unable to articulate your needs, while in a healthcare setting, a hospital in particular, it is instrumental that you have one person, if not two, who can speak on your behalf. When you have family members coming in, when you have friends perhaps, depending on where your family is, trying to make decisions for you and not knowing what you want. By having a healthcare proxy, you articulate on paper what kind of procedures you do and don't want in your life moving forward if you are in a position where a clinical team has to decide how they're going to take care of you. If you're gay or lesbian or a part of the LGBT community in general, you may not have a close relationship with your family and you don't want them making those final decisions for you. So having a legal document that the hospitals have to respect, that your friends or family members who you put in charge of your healthcare decisions know what it is you want. Do you want to be on life support? Do you not want to be on life support? Do you want to be on life support for a certain amount of time? By having it on paper, there's no conflict with religious beliefs, there's no conflicts with cultural beliefs. This is what I want, and this is what they'll have to do.
Of course, for some of the same reasons, I guess it's important to have a will drawn up.
Absolutely. You see all the time conflicts that families have, and look at the rich. Aretha Franklin died without a will. Prince died without a will. We've already seen some of the, I'll use the term mishigash, that happens amongst family members trying to then make decisions based on their individual needs or what they think the person who died wants. If you have any kind of property, and a lot of people think they don't have anything, but even if it's just jewelry, if you have a home, if you have a car, put it down on paper, or beforehand, put the person's name on it, make them a co-signer. But to avoid the family fights, to avoid conflicts, and also tax shelters, have a will, talk with an attorney, talk with a financial planner to help you figure out the best way to protect your property and protect your family who you want to bequeath the property to.
I can imagine a lot of people in Boston who don't have much in the way of liquid assets, but they have a house that they've lived in for a long time. And as they get older, they might want to think about that house as a way to secure some credit.
Right.
And I guess that could also be a gateway to some problems.
It absolutely can. I mean, you know, ownership of the home can be in debate. If you own the home, that's fine. If your family owns the home because it's a family home that you grew up in or generations grew up in, so various cousins have a little piece of interest and your siblings have a piece of interest and an aunt who lives in Minnesota, you need a lawyer, you need a financial planner, you need legal documents to clearly spell out what is mine, what can I do with it, how can I use it to take care of myself moving forward. You may need to move out of your home, or we hope have the option of aging in place, and you might need to renovate the home. So are you in a position to take out a loan? Can you do a reverse mortgage? Do you have equity in the house that will allow you to get cash in some other way? Talk to a financial planner, talk to a lawyer, talk to your bank. And again, we are going to cover some of this at the conference on Saturday, November 2nd.
What about long-term care? I know people with more wealth and assets that, you know, they have options, but what about people who don't have those?
Well, this is my public health hat now. Again, we're fortunate to live in a state that has an incredible healthcare system, but it still isn't cheap, whether you're rich or you're poor or somewhere in between. Again, planning, looking at places for retirement, looking at retirement communities that have graduated systems. You come in, you can have an apartment, then you go into assisted living, then you go into long-term care. All of those are options here in Boston. You do need to spend some time and energy looking around, talking to elder social workers who have a very keen sense in this. And in terms of financially funding this and supporting this, again, examine the income that you do have. Your life insurance policies, can you liquidate them? Your retirements, 401ks, whatever. How will you be able to use any of those monies to be able to take care of yourself in the long term? Again, some of this will be covered in the conference, but going forward, it is something that we really advise people, talk to your financial planner. For a lot of folks, open enrollment will be happening at their jobs. This is a great opportunity to talk to the people in charge of your retirement funds and ask these sorts of questions.
Well, there are many people with at least something in the way of a retirement fund, but for most of them, you know, good advice might be hard to afford.
Yeah.
What would you tell them?
It's never too late to start saving. Every penny does count. Very few people actually win the lottery, so that's not a saving plan. What we say is pull your paperwork together, talk to a financial planner. Many jobs, if you have a 401k or any kind of retirement plan, you can call that offering and talk to someone there. You can come to the conference. You can make arrangements. There are financial planners through your banks as well, especially credit unions. Go with somebody reputable. Do not spend a ton of money having somebody look at your paperwork and giving you advice. If you have any kind of investment, call that company first and sit down with them and have them walk you through what some of your options are. Each person's situation is unique, so there's no way to give a one-size-fits-all kind of answer to this other than sit with a professional, have a list of questions, write them down, and go forward from there.
Finally, Jacquie, is there anything else we need to tell viewers about when and where the workshop is held, and if there's anything they need to do in advance?
What's wonderful is that the conference is free. It is absolutely free to anyone. You go to our website, www.aarp.org/Massachusetts. The event is Saturday, November 2nd. It's being held at the Suffolk Law School from 8:30 to 3. So we ask people to pre-register, and or you can register on site.
Thank you very much for being with us.
Thank you so much for having us. I greatly appreciate it.
And Jacquie Bishop from AARP, Massachusetts. We'll have more news in just a moment.